Hello, everyone. It's Richard Reeser here, General Secretary of the Commonwealth Disabled People's Forum, and I'll be joined by Sarah Kamau, our Acting Chair from United Disabled Peoples Kenya, and she'll introduce this module in a minute. The subject today is disability and data, and we're trying to drill down a bit to make sure people have a real understanding of what data means and why it's important, rather than fill you with too much information. We've got 3 interactive sessions and 3 or possibly 4 films, depending how much we use the interactive session. At the end, I've got a few housekeeping things to say, but so without more ado, I will pass you over to Sarah to do the introduction of this module. Sarah.
Thank you, Richard. And hello, everybody, and welcome to this module on disability and data, which is very important for persons with disabilities to be known by numbers and types so that they can be planned for. And by a way of introduction, I will start by saying the journey starts with the need for data so that it can be used for evidence-based advocacy. To get the data for evidence, advocacy needs to happen to ensure that those responsible for collecting and gathering data do so. This is where important advocacy work at national and international level needs to happen to influence those required to create data. This is beginning and is foundational to all other efforts. The second aspect is once the data exists, it is vital to understand how to analyze, to use and trust it for advocacy messaging. This is both to protect the integrity of advocates and to ensure that the change sought is based on an understanding of the reality of the situation and what works. Gaining an understanding of these aspects, particularly for those working at grassroots levels, to better understand the use of data in their advocacy is vital. Data literacy and turning data into a compelling message is a crucial part of gaining implementation of SDGs and UNCRPD. This can be found in the website that is quoted there in your book, you will see in your course book. I'll also share a snapshot of global disability statistics. There is 1 billion and above people who live with a form of disability currently. 200 million of this experience extreme difficulty in functioning. The prevalence of disability is on the rise. This is due to aging, populations, and a global increase in chronic health conditions. 2/3 of all the years lived with a disability in low and middle income countries is due to chronic diseases. We'll also talk about better health for people with disabilities according to the World Health Organization. I'll just try to increase the font because I'm not able to read it very clearly.
It's the same as
I think, Richard, you can help me. I can't see it as well as I do.
Is it in the wrong place maybe or something? Because I've put it over.
Because of the two of them in the same. So this one has become very small.
Okay, well, I'll help you out with the first one.
Please
so what it says is over 1 billion people globally experience disability. That's 1 in 7. People with disabilities have the same general healthcare needs as others, but are 2 times more likely to find the healthcare providers' skills and facilities inadequate, 3 times more likely to be denied healthcare, and 4 times more likely than non-disabled people to be treated badly in the system. Half of people with disability cannot afford healthcare. 50% are more likely to suffer catastrophic health expenditure problems. These out-of-pocket healthcare payments can push a family into complete poverty. Rehabilitation and assistive devices can enable people with disabilities to be independent. And what are we talking about here? Well, 970 million people need glasses and low vision aids. 75 million need wheelchair, but only 5 to 15 million have them, as we heard from our speaker on motivation a few programs ago. 466 million people have disabling hearing loss, but only about 10% actually get hearing aids, and only 3% in low-income countries. Making all healthcare services accessible to people with disabilities is achievable and reduce unacceptable health disparities, but it will require access, it will require making it affordable, and it will require training for all health personnel and invest in specific services such as rehabilitation. And we've seen over the COVID pandemic globally how health services have not really been prepared to meet the needs of disabled people. Can you read the other one, or shall I go on, Sarah? Then the other thing that's on here on the screen is mental health, the cost of stigma. This isn't based on such wide data. It's based on 16 countries, mainly developed countries. But 3 in 20 working age people are affected by moderate or mild mental health difficulties, and 1 in 20 have serious mental health difficulties. People with severe mental illness die on average 20 years earlier than other people. Depression is the leading cause of disability in higher, middle and low income countries. So that's across the world. Children with disabilities face malnutrition because food is safe for other children and household members. A study over 19,000 people in 16 countries found 39% think that seeking help would mean losing friends. 49 think seeking help would mean limited opportunities. And what they also say is that the effect of mental health is a 4% drop in GDP, contributed by people being in long stay hospitals, lost hours of work, emergency healthcare, increased crime and low productivity. And we'll be talking about the Sustainable Development Goals later, but there is a goal here under 3.4, reduce premature mortality from non-communicational diseases through prevention and treatment, and promote mental health and well-being. So we can talk about that when we come on. So sorry I had to read that for you, Sarah, but I shall carry on then, shall I? Okay. Yeah. Recent estimates from the World Health Organization estimate there are now 2 million disabled people. So we said 1 million there, but in 2021, they think it's upwards of 2 million. And this all depends where you put the line in terms of who you consider disabled and who not. And we'll look at an example from Zambia in detail so people will understand how that is. But these are the global figures they're coming up with currently. 1.3 billion people are affected with some form of blindness, visual impairment. This represents 17% of the world's population. Many countries don't count wearing glasses, and that's why the difference comes up quite easily. 466 million people have a disabling deafness or hearing loss. 200 million people have intellectual disability. This represents 2.6% of the world's population. 75 million people, the same as the others, wheelchair users or potential wheelchair users. These figures remain at an evolutionary average, but one thing is certain, that the number affected by any form of impairment represents a significant part of the world population. From adults to children, it's also important to underline the facts that some people have multiple impairments. So counting them, the data becomes a really important issue. And there are lots of different sources of data, and we'll see in a moment from a business why they can use the data for their business case. But for us as activists and DPOs, it's important that we understand you can get data from surveys of the whole population, which is called a census, usually takes place every 10 years. And so the question asked there is vital. You can fill in data in between censuses by doing sample surveys, and I'll explain more about that in a minute, of households. But you can also gather data from things which gather data about people every day. Children who go to school every day have whether they're there not recorded in a register. So we actually have data for all children in the world, whether they're in school or not that day. If we record whether they're disabled as well, and what type of disability they've got, we can actually get data for school attendance for all children in the world, or if they're not in school at all. So you can see how that sort of data would make a huge difference if it was properly collated and collected. So some of the data that's been gathered is put to a business case here by Barclays. So we'll have a look at this.
We're often asked, how many people have a disability? Or what's the value of the disability market? These questions can be tough to answer because there isn't a lot of data on disability which we can rely on. However, we've done some digging and come up with some key statistics to help. So here are 5 top facts about disability in the UK and beyond. 1. In the UK, 1 in 5 people have a disability. That's about 13 million people, or the combined populations of London, Birmingham, Glasgow, Leeds, Bristol, Liverpool and Manchester. Globally, there are over 1 billion people with a disability, which is roughly the populations of the USA and all European countries combined. 2. The spending power of disabled people and their households is £265 billion a year in the UK. This is called the Purple Pound. Globally, it's $8 trillion. That's a market that we can all agree is unaffordable to ignore for any business. 3. 7 in 10 disabled customers with access needs will click away from a website they find difficult to use. And only 1 in 10 will complain about inaccessible online experiences. So just because you're not getting complaints doesn't mean you don't need to take action. 4. Employment of disabled people is lower than the rest of the population, with only 50% of UK disabled adults being in employment, compared to 80% of non-disabled UK adults. This is known as the disability employment gap. Organisations actively committed to becoming disability and mental health confident have seen demonstrable benefits, including access to a wider talent pool, more diverse ways of thinking and innovating, which results in better customer services and greater profitability. 5. 3/4 of people with a disability have more than one. 3/4 of disabled adults in the UK have at least 2 disabilities. This means that when we think about how we design for disability, we should consider that we might be designing for multiple conditions at the same time. On top of that, we should also consider people who are situationally or temporarily impaired from time to time, which means all of us. To find out more, visit barclayscorporate.com/accessibility.
Okay, so some interesting points there.
We're often asked, how many people have
the effect that the money that we have is a big commercial factor, and therefore businesses that don't get us in. So that statistic is being used to encourage people to make reasonable accommodations in their businesses and to employ more disabled people. It's also about using it to make sure that the business is more accessible in terms of the portals that it uses for getting information. So these are all quite positive things. So we can see how data can be really important. And if you bring it down to the level of low and middle income countries where we have much less data and most disabled people are not recorded, we can see that there's a big challenge that we face. So let's see what you think about this. Our first chat activity for today is 2 points. Why is it important to know numbers of disabled people in your country and the world? And 2, is it important to break these figures down by different types of impairments, and why do you think that is? So I'll say that again. And could you put answers in the chat for both of them at the same time? One, why is it important to know numbers of disabled people in your country and the world? And two, is it important to break down the figures by different types of impairment, and why do you think that is? Okay, so put your answers 1 and 2 in the chat, and you've got about 90 seconds to do that now.
Maybe you want to finish one minute too.
Well, I think that's about 90 seconds. So have we got some answers in the chat, please? And who's going to read them out? Sarah or Gemma, or the two of you?
Sarah, are you there?
Yeah, we have some chats, Richard.
Okay, do you want to start reading them out?
Deepa Venkatesh says to provide reasonable accommodation. Abdul Wahab Matepo, knowing the number guides in planning.
Yeah.
That's planning. Then there is also Simon Mino Achieng, also for planning and implementation of programs and for program purposes.
Yeah.
The Joy Ubong Ni, it is important to know the number as this would inform the policies made and create an equal opportunity that accommodates all.
Good, yeah.
Grace Stalin, so that we can ensure that disabled people are recognized and to ensure that there is enough support and resources out there for disabled people. This will help in budgeting from Mkonya Newton. Goretti Biomire UG, it becomes easy for the government to take informed decisions.
Yeah.
Huata Diogratias, yes, it is very important because it can show the clear statistics of disabled people and also give government a proper planning and advocacy by the DPOs. Leslie-Ann Huggins, to know the prevalence and be able to know the population for decision-making process. It is important to break it down because disability is diverse and should not be generalized. That I think is for number 2.
Yeah, and Leslie, by the way, congratulations on your degree, which you circulated to us. Well done on that.
Okay. Gwanda Caroline, for planning purposes, budgetary allocation, and to address their needs based on the data, also to be part of the decision-making table.
Yeah.
Fiona Akulu, Okello UG, knowing the number acts as an advocacy tool and also helps in budgeting purposes by different stakeholders. I think planning and budgeting has come up severally.
Planning and budgeting and influencing government.
Yeah.
I like the point about as a way of creating equal opportunities and reasonable adjustments. So I think that's covered that. Are there any other points on why we should disaggregate? Number 2, break it down by different impairment groups, and are they the same answers that people are giving?
Okay, I see a different answer here, Beth Terry. So people can recognize what a sizable proportion of disabled people in the world and support them as such. Let me scroll down. For better utilization of manpower according to the nature of disability by allocating the work properly.
Yeah, okay.
And that is from Kingsley Njoku. Sorry, I didn't mention the name.
Thank you, Kingsley. Yeah.
I'm just trying to scroll down to see if there's any different response. There are many and they're still coming in, Richard.
Yeah, but mainly similar, I think. We do record the chat and put it up so people can have a look through it.
Okay.
Okay, so thank you for that. And thank you, Sarah, for doing that. So how does this work? Well, DPOs and activists who are around the DPOs need to see that they get monitoring data, the level of data, the quality of the data, how good it is a really key job. And there should be someone in every organization, whether it be a single impairment DPO or for a gender DPO for women, for instance, or children, who has got their eye on the data that is being produced and look for gaps, what isn't there, and frame questions to advocate for better data. So we need to monitor what's there in our countries to see it, and then to advocate for better data. And if the country is still using old style questions, such as, are you disabled or do you think you're disabled? They're going to get very low results, because we know from the research that's been done that people don't answer positively to that in many cases. So we need the data ourselves to use to advocate for better provision, for changes in the law, for better services, for places in Parliament. There are a number of Commonwealth countries, such as Uganda, that have designated places for people in Parliament, and at every level of local and regional government. How many places we have will depend on how much data is there. So, for instance, in South Africa, I think there are 6 places in the government, but there are probably far more people who should be in the Parliament to be, if we're going to have a representative group of disabled people. And using positive action like that is a way, because otherwise it's very likely that disabled people wouldn't be voted in if it was a general vote. So that's why sometimes those methods are used. So we can use data in that way. We can also contribute to filling the gaps. And there are several ways that DPOs can fill the gaps. First of all, we can do our own little surveys, mini surveys of that data to show up what's missing. One way is to go into a rural area and go out and knock on the doors and find out how many children are not in school because they're disabled. And that's a way that we can immediately confront government and say, you know, there's a duty for every child and you've signed up to it to go have primary education. So why are these children out of school? We can do a qualitative study. That's different from gathering numbers. It's getting people's opinions. So we might want to ask the mothers and families of why they're not sending the child to school and present that as data that the government needs to think about. So there are lots of different ways that DPOs need to be involved, and really there needs to be a subcommittee in a national DPO. There needs to be someone in each DPO who's keeping an eye on the figures and bringing them to meetings so people understand what's going on. So everybody can use data in their advocacy when they go on the local radio, papers, local television. These figures catch in people's minds if people have them. So here is someone from UNICEF who's going to tell us a bit more about their collecting of data that they're doing.
Shots of children with and without disabilities playing and learning together.
Richard, could you turn it down a little bit, please?
Resource package.
A bit more.
Collecting and analyzing data on persons with disabilities. Introduction.
Welcome
Better.
and thank you for watching this video. My name is Claudia Kappa and I'm the focal point for disability data in UNICEF. As we all know, disability data and research has been terribly inadequate, particularly for low and middle income countries. This has mainly been due to limited investments in data collection. When data have been gathered, different methodology, different definitions, different methods have been used, which has resulted in statistics of varying scope and quality and has made comparison of statistics across countries problematic. Data are essential for the planning of services and for monitoring and ensuring the participation of persons with disabilities. The Sustainable Development Goal clearly states that disaggregated data are needed and countries should collect data that will allow them to report on the achievement of the different Sustainable Development Goals for all people, including persons with disabilities. Ensuring that persons with disability are not left behind requires systematic data collection efforts based on tools that reflect international definitions and standards and do not use stigmatizing or offensive language. This is the key to producing reliable statistics on persons with disabilities. In the last 5 years, we made important progress. There are now tools that are available for countries to use that can allow countries to collect information on persons with disabilities, including children with disabilities. These tools have been developed in collaboration with a number of stakeholders, including national statistical offices, governments, academics, UN and other development agencies, and most importantly, representatives of disabled persons organizations. UNICEF is a proud member of the Washington Group on Disability Statistics. This is a very important mechanism that brings together national statistical offices and international agencies with a joint goal of developing and promoting standardized data collection tools on persons with disabilities. Together with the Washington Group, UNICEF has developed a new questionnaire that can be used to identify children with disabilities. We are very excited that this initiative has generated a lot of support and enthusiasm. But now financial resources, technical assistance, and capacity building opportunities and tools are necessary to support the use of the module at the country level. This video serves as an introduction to 5 clips that are meant to promote awareness about disability statistics, discuss challenges and opportunities, and share information about the available tools that countries can use to collect data on persons with disabilities. There are 5 videos as part of this training material. The first video discusses challenges in collecting data on persons with disabilities and review the availability of statistics. The second video will provide an overview of the child functioning module that has been developed by UNICEF and the Washington Group on Disability Statistics. The third video presents the work of the Washington Group on Disability Statistics to develop a module that can be used to collect information on adults with disabilities. And the last video presents different strategies, techniques, and ways in which data can be used to present the situation of persons with disability and promote change. Mitch Loeb from the Washington Group on Disability Statistics will be my partner in delivering the videos. We hope you will find this material useful and relevant for your work. Thank you.
And you can find those on the UNICEF website. If you put in data, you'll get those 5 videos. We will see a second one during this seminar, and in the presentation that is up on the website, we're using the third one, but 2 of the other longer ones you'll have to look up yourself. Now, to show you why data is important, The UNCRPD committee, that's the committee of disabled people elected by state parties, and now for the first time is gender balanced. And I think all but one of the people on the committee are disabled people themselves. When countries are asked to submit reports, DPOs and other civil society organizations can put in comments. And this takes us back to the comments that were made by June Reimer last week in terms of what she told us about the Aborigine and Torres Strait Islanders in Australia, that they seem to be disproportionate in the criminal justice system. And this was picked up in the report of the UNCRPD committee. It says Australia, in response to the absence of national data disaggregated by disability at all stages of the criminal justice system, including data on the number of persons unfit to plead who are committed to custody in prison and other facilities. And what they recommend is collect data disaggregated by disability, age, gender, location, ethnicity, which is June's point, at all stages of the criminal justice system, including on the number of persons unfit to plead who are committed to custody in prison. Now that clearly came about, not because the Australian government went to the committee and said, no, we're not very good at doing this. It came about by the shadow reporting system, or parallel reporting system as it's also known, and organisations putting this in, either in writing or going to Geneva in person to actually make this point. And the advocacy message is disaggregated data on disability, age, gender and location ethnicity is important for understanding the population of persons with disabilities. So we have a means of pressuring government at the highest level through this, but we should be looking at what they're doing all the time and in regular meetings with them saying you are not collecting data on this, you're not disaggregating it by disability or even types of impairment. A second one, Kenya, and this I'm sure is to do, and Sarah, you may have a comment on this, the committee is concerned about the multiple forms of discrimination faced by women with disabilities, absence of measures to prevent and combat different forms of discrimination against them. It is also concerned about the lack of information on public policies and programs on gender equality and include the rights of women with disabilities. So again, lobbying must have taken place for that to be flagged up by civil society and DPOs. So the committee recommends systematic collection of data and statistics on the situation of women and girls with disabilities living in rural and urban areas belonging to ethnic minorities and pastoralists. And we heard last week from someone from a pastoralist community. So again, advocacy leading to the committee recommending government change its collection of statistics methods. And we urge our government to ensure that the data and statistics on women with disabilities is collected so it can be used for the development of better programs. Sarah, do you want to say anything about this on Kenya, how this came about? Maybe she's left us temporarily. Sarah? No, okay. I'll ask you again when you come back on. And the third example, again from an area where we have a lot of members, the Pacific Disability Forum. I think we have 13 members in their area who are Commonwealth countries, all mainly small island, apart from Australia and New Zealand. Disabled People's Pacific Disability Forum been working with national DPOs across a range of countries to advocate for inclusion of the Washington Group short questions, which we're going on to in a minute, in the national census. This came out of a housing survey that neither the DPO or the government had the capacity to carry out, and carried out regional training with the Washington Group and the regional body. They developed in Kiribati a disability monograph used to funding, which was funded by DFAT, the Australian Foreign Affairs and Trade Ministry. Since the production of the Kiribati monograph, detailed analysis has also been undertaken in 4 other small island countries, Samoa, Tonga, Fiji, and Tuvalu. So often the capacity isn't there to do this, and we have to work with government and other international agencies to build that capacity so that we can actually get the data. So let's now get down to the nitty-gritty in terms of what it means in terms of collecting data. If there was complete equality in this graphic representation of employment and disability, those two bars would be at the same height. We already saw this bar being used by Barclays, showing there was a 30% gap in the UK. In most parts of the world, the gap is larger than that. And this is something that should be monitored and initiatives should be taken. So that's a very simple use of data, making sure that this disaggregated variable is always available, that each year it's published, and you can actually give awards to companies who have actually increased the employment of disabled people and so on. You can also give tax breaks and various other things so that you can actually change the situation and monitor it by using data like this. But to illustrate the measures for the general population, let's have a look at Zambia as an example, a small African country. The tools chosen to measure disability in the population mirror the different wisdom about disability. And back in 1980 and 1990, they reflected the pre-paradigm shift. So a really medical model approach. One dimensional approach, cause and effect model, focuses on impairments based on medical normative views. The question is, do you have a disability? This was the actual question that was asked in the census. Are you disabled in any way? If you answered yes, you then went on to be asked which of these fits you best: blind, deaf, dumb, crippled, mentally retarded, multiple disabilities. And because of stigma and shame around disability, many people wouldn't have answered this. And indeed, only 0.91%, that's less than 1% of the population, answered yes to it in the census in 1990. Another survey was done using more detailed questioning in 2000 and found that 2.7% of the 11 million population did now say that they, so that had gone up more than 2.5 times. However, when a survey was done that used the Washington Group short questions in 2006 on a household survey, this is of living conditions, and let me explain how this works. It is not a census where every household door is knocked on. It is a statistical sample, usually randomized. So you put all the names of households, maybe on the electoral register, into computer, and you pick out a random number of them. Or you can stratify it so that you want 50 or 100 in each sector, each region, and then randomize it. And that's how the numbers would have been got. And they went and they asked them this question: because of health problems, do you have difficulty seeing even if wearing eyeglasses? Do you have difficulty hearing even if using a hearing aid? Do you have difficulty walking or climbing steps? Do you have difficulty remembering or concentrating? Do you have difficulty with self-care, such as washing all over or dressing? Do you have difficulty communicating, for example, understanding or being understood by others? And then the enumerator, and this is an important point, who collects this data? People are trained, not very well, to collect this data. They go over the questions and how to answer them and tell not to introduce bias or put people off. So that if you pulled a face and said, is there anyone has a health problem, and scowled, then you'd get less of a result. 4 discrete response categories were offered to the enumerator. If they said no difficulty, that was as far as they went. If they said some difficulty, they would put a mark against which of these 6 they had some difficulty. A lot of difficulty, a mark against that. And unable to do it at all, a further mark against it on their sheet. In total, in this survey, 5,751 households were included in the sample. This represented 28,000 individuals, or 0.24% of the Zambian population, which at that time was 11.5 million. 3,090 individuals, that's 11% of the sample population, were identified as having a disability. But it got more complicated than that, because once adjusted following a sample of in-depth interviews, the level of inclusion for disability prevalence is at least some difficulty. So some difficulty in carrying out at least one of the 6, they found that 17.8% said that they had some difficulty. But more conservative cutoff point was used, at least some difficulty on at least 2 of the domains or 2 of the indicators, it was 13.4%. Now, how different is that to the 0.91% that we got back in 1990? And to show how the degrees in difficulty work, so remember what those are, some difficulty, more difficulties, or unable to do it in D3. I'll put those up as well. At least some difficulty is D1, at least a lot of difficulty D2, unable to do it D3. And then look for the different domains. Vision, 4.7% some difficulty, 2.6% a lot of difficulty, and 0.5% blind, effectively, because they couldn't do it at all. So that's 1 in 200 people are blind in this survey. Hearing, 3.7% some difficulty, 2.3% a lot of difficulty, who would benefit presumably from a hearing aid, and 0.5% would be profoundly deaf. So they can't hear at all. 5.1% had some degree of mobility problems, 3.8% a lot of difficulty, and 0.8% couldn't mobilize. So if you add that up, that's 9.7%, 9.6% of the population, that's 1 in 10 had a mobility impairment. Remembering, 2% had a problem with some difficulty, 1.5% a lot of difficulty, and 0.3% couldn't remember at all. They may have had dementia, or they may have had severe learning difficulty. We don't. And it doesn't really matter for this. It means that they have a difficulty and they're facing barriers. Self-care, that was washing all over or dressing. 2% some difficulty, 1.3% a lot of difficulty, and 0.4% couldn't do it at all and would really require personal assistance or family care. And then communicating as well, there we had 2.1% on the some difficulty, 1.4% a lot of difficulty, and 0.5% on the severe. If you remember the second slide that was shown, it said 200 million people have severe difficulty. It would be adding up that D3 column around the world would be how you would get to your 200 million. And remember also that if we take the D1 into that, it is likely that it's going to be 2 billion people around the world, so that we are very likely to find at least 20% of people have some difficulty in most countries. And then what was the conclusion of this? For the multiple purpose of promoting inclusive economic social development, measuring the level of functioning in the population, or providing services to people with disability, it is more appropriate to measure disability through multidimensional sets of parameters rather than the all or nothing, are you disabled or not? And I think that's been shown by this data, and similar data have been gathered in many other countries to show the same pattern. Data from Zambia have illustrated that different instruments used to measure disability based on different approaches to disability yield quite different estimates and prevalence. So beware of people saying prevalence rates. Ask, what tool did you use to get to this? Drill down into it and ask yourself, as a disabled person, what would I have answered to this question that's being asked here? What would other people I know answer? And that will give you an idea of what to lobby for to change surveys that government and other agencies do and censuses. Okay, so we're now on to the second activity on the Washington Group questions. What do you think are the advantages of the Washington Group set of short questions over asking people if they're disabled or not? That's the first one. What are the advantages of using the multi-dimensional approach that we've seen there? And I'll put it back up on the slide when you're thinking about that. What's been left out of those 6 domains? Are there areas that have been left out that we should be adding? And last one, just for those people who want to share it with us, have you experience of either being interviewed or trying to gather data yourself that maybe there's a point you want to make to us? Okay, so those are the things to think about in this second activity. One, what do you think are the advantages of the short set of questions over just asking the one question? And what might be left out from the Washington group? And do you have experiences you want to share with us? And I will go back to, that's the 6 questions there. So first question, just asking people, are you disabled or not, or asking those 6 questions. What's the advantage of that? What's left out of those 6 questions is the second one. And the third one, do you have any experiences you want to share? Okay, we'll give you again 90 seconds to get stuff written into the chat. Back to the questions. So hopefully we've got some answers for people that we can share. Yeah, that's the time I said is now up. Who wants to read this one out? Gemma, do you want to have a go at these?
Okay. So answers to number 1. It is, we've got a lot of ones here. To provide reasonable accommodation, knowing the number guides in planning, for planning and implementation of programs purposes.
So we're not reading out the first lot.
This is to do with the first one, sorry.
Yeah, I've heard those before.
Yeah.
This is activity 2.
I'm so sorry. I thought there was a lot of chat there. Okay, hold on. It's difficult because of the way that they were separate. Okay. So it's kind of polite way of asking, more empathetic.
Polite way of asking, yeah. Okay.
It makes the questions more specific, which allows more data to be gathered for disabled people. People are more open to answer to their difficulties rather than the actual question of are you disabled? A person would be more receptive to answer if they have a hearing problem rather than are you deaf? It's non-discriminatory, short, clear, to the point and precise. It creates confidence amongst disabled persons and recognised. It's the polite way of asking questions. It's more comprehensive to gather such data without fear of stigma. It's better to ask more questions than one. More subtle, better language. The short form questions have the advantage of being easy and quick to administer. Some questions are too discriminatory, hence disabled people find it difficult to open up. It's therefore important to ask questions that don't directly mention disability.
Yeah, that's a good one.
It's easy to answer and understand. Again, somebody else said it's polite. They're specific questions. The questions keep in mind to ask in dignified and respectful manner, properly deployed and use the right diction or language that doesn't show discrimination or racist statements. They allow others to recognise their own disability if they did not already know.
And let's go on to what was left out from those 6 domains. That has anybody put down what they think might have been left out?
Yes. Are you using an assistive device, e.g. wheelchair, cane, walker, service dog? Less, all or none, more practical, as it doesn't assume everyone is using the same definition of each type of disability. Not too many on this one. Sorry.
The main criticism I can tell you that has come out has been that people with psychosocial impairments have said, well, there's nothing really here for us to say. We don't necessarily have communication or memory problems. We have other issues.
Yes.
And so
somebody has actually said they put number 3, which is my fault for not reading the question. I just saw the number. Yeah. I think mental health is not explicitly captured. Yeah. That's missing. Yeah. And someone actually says as well, this is good. Do you have any tactile dysfunction, issues with touching or feeling certain or different textures?
Yeah, that's one. And I don't think they've even put that in now. They have adapted it to include some other things, but texture and touch hasn't been mentioned yet, I don't think. So that's a good suggestion. And is there anybody on the call who has actually either been on the receiving end of an interview or has been involved in gathering data and might have something to share with us? You could maybe put your hands up if you want, if you've got something to say on that, and we'll come to a few of you.
Yes, Freaky Andrew, do you want to unmute?
Hi.
Hi. Yes, tell us your experience.
Okay, so I do a bit of research in disability, and I had the opportunity to carry one out on quality of life. And yeah, so for me, what was interesting about it was even identifying a tool that I could use that would be will cut across. So persons with disabilities. So this is what I ended up doing. I used the short form questions, World Health Organization quality of life, abbreviated version, and then I limited it to persons with physical disabilities. That way, I was able to capture a particular sex as opposed to trying to impose questions across board. And to also qualify that, I had to do activities of daily living just to help with ensuring that the questions were very robust and getting answers. The other challenge I had was having to work with persons who were persons without disabilities in administering questionnaires. Took a lot of training to get them to ask the questions respectfully and get answers. So those are some things that
yeah, and I think that's an experience that's been reflected everywhere. But is the one result that came out of what you did that you can tell us, or is it not there to be told about?
Oh yes, no, we actually published research, and what we're able to, of course, establish is the quality of life for persons with physical disability is low, and that a lot could be done to improve quality of life.
And what country was that? Forgive me, I can't
Nigeria.
remember. In Nigeria.
In Nigeria. Yes.
So your survey showed that the quality of life of people with physical impairments was low. And did you make suggestions about how it could be improved?
Oh yes, we did that because I did 2 researches. One also had to do with functional assessment of persons with disabilities. So in joining both researches, one of the recommendations I made was had to do with allowing persons with disabilities to work because they are functionally able to actually work and make income and have impactful living as opposed to just being on welfare, which is what we're pretty, so
that's a general point, because in many countries, and we had this, I think, last time in South Africa, that if you are on a pension, then you're prohibited from working. Whereas in the more developed countries, the pension is for the extra cost of being a disabled person, and you are still allowed to have a job and to earn as well. And so there's a real issue there that needs to be tackled. It's an attitudinal one. People will say, well, if they can work, why should we give them any money? Well, the reason we need it is because the quality of life, it costs much more to get around the barriers than everybody else. So that's a really useful thing you've started us thinking about. So thank you for that. Okay.
Thank you.
Thanks for that. So we'll go on now. Oh, I think maybe we can take one more, I think. Yeah, one more.
Okay, there's a few with their hands up.
Okay.
Bernardina in Belize.
Okay, let's have one from Belize. We haven't had someone from there for a while.
Good morning from Belize. Can you guys hear me?
Yes, we can hear you well.
Okay.
Your experience.
So my experience with gathering data from people with disabilities, we use a database as a social worker here. I would usually do family assessments and ask about individual members of the household, and I don't think our database is very thorough. It usually would ask about, like, the first person would be, like, for example, the head of the household, and it would just list the disability. If they have issues with hearing, seeing, self-care, walking, remembering, or are visually impaired, and then the person gathering the data, such as myself, would have to rate it as none, no issues, some issues, a lot of issues, or cannot do any at all. So and I don't think that our database is thorough enough to
Washington set, really, by the sound of it. Would you say it was largely based on that?
We don't. Yes. I'm not able to identify when people are have issues with speech. I can't tell from this, if I don't know already, if they have intellectual disabilities, tactile dysfunctions, mental disorders, people and so on. So that's just my experience.
Or not? People with autism, is that picked up on your survey?
No. Well, I work, if based on my previous knowledge, I would know, but then this doesn't capture it. So I'm just like identifying that our method is kind of falling short.
Okay. Thanks for sharing that with us. So obviously you've got some advocacy to do within your workplace to get a better survey going. So thank you for that, Bernadette. All right, so we'll press on. I know that we could have had more people speaking, and thanks for putting up with that. We'll see if we can come back to you in a bit.
Shots of children with and without disabilities playing and learning together.
Richard, could you turn it down, please?
Resource package on collecting and analysing data on persons with disabilities.
All right.
Yeah.
UNICEF Washington Group module on child functioning. Claudia Kaplan, Senior Advisor, UNICEF.
Welcome and thank you for watching. In this video, I would like to talk about the module developed by UNICEF and the Washington Group on Disability Statistics to identify children with disabilities. This module is a questionnaire that can be included in household surveys and censuses. It is addressed to mothers or primary caregivers of children between the ages of 2 and the ages of 17. The module inquires mothers or caregivers about the difficulty that children might have in performing certain activities. These difficulties may be the results of conditions or impairments that children might have. These impairments and these conditions can lead to limited participation of children in society in unaccommodating environments. These are societies where children with disabilities are unable to participate because of barriers that exist in the society. Let me give you the example of a child on a wheelchair. In an accommodating environment, schools will have ramps, and children with wheelchairs will be able to access the school building. In accommodating societies, teachers will have positive attitudes vis-à-vis children with disabilities. On the other hand, in an unaccommodating environment, teachers might have stigmatizing views on children with disabilities, and these children might be left behind. UNICEF and the Washington Group have developed a module that can be used to identify children with disabilities and document the barriers that they can experience in accessing education, health, and other services. The module was developed
through a consultative process that started in 2011, when UNICEF joined the Washington Group on Disability Statistics. The Washington Group is comprised of national statistical offices and different development agencies that work together with the aim of developing and promoting standardized data collection tools on persons with disabilities. In 2011, UNICEF joined the group with the specific purpose of working together to develop a module that can capture children with disabilities. We developed this module in consultation with a number of different stakeholders. We brought together experts in child development, but also we consulted with representatives of disabled persons organizations, because we wanted to develop a module that can produce reliable and valid data, but also a module that can truly capture the living experiences of children with disabilities. The module that UNICEF has developed in collaboration with the Washington Group focus on difficulties that children might have in performing some daily activities, like learning, difficulty walking, difficulty seeing, difficulty hearing noises, but also difficulty in managing emotions and difficulty in playing. All domains of development that are very important to capture in a survey or a census. The module has been tested in different countries across the world because we wanted to develop a tool that can be used in different contexts, in different societies, in different cultures, and capture the same population of children with disabilities. We tested the module in the United States, in India, in Cameroon. We tested the module in Jamaica, in Cambodia, using different languages and with support for many different partners. The module is currently available for country to use and is available together with accompanying material that can explain how to collect the data, how to use the module, how to conduct the interview, how to analyze the data, and most importantly, how to translate the statistical knowledge into action. The material is available on UNICEF data website at www.unicef.org.
Children with disabilities in schools around the world.
So that's really interesting. And if you look down the left side of the screen there, I'll read it out. Functional domains that they're covering in the 5 to 17. Remember, there was another one for 2 to 4-year-olds, which had playing and a few other things in it. Seeing, hearing, walking, self-care, communications, being understood inside and outside the household, learning, remembering, concentrating, accepting change, controlling behavior, making friends, anxiety, and depression. So we can see that this is an attempt to move to include the psychosocial, mental health, as well as just learning difficulties. So I think there's a big improvement in this. And the testing of it has shown that it does pick up people on the autistic spectrum and other psychosocial conditions like ADHD and so on. So this has been very useful and it's been applied in more than 60 countries. And the tools that she mentioned there are really tools that you might need to make sure that people carrying out surveys do, because it's crucial, isn't it, to have a good idea of the number of children with various difficulties in our population so that we can adjust our school system for them. And what's very clear, because the numbers are quite large, is that the segregated solution of the past, separate special schools, is not the solution. The solution has to be the training and accommodation and in the schools, removing barriers and so on. And if we don't get this right from the early years onwards, then we're going to have further generations of disabled people who are disadvantaged. So it's a really crucial thing that we actually take this on board. And that's why I included it particularly in today's seminar. We'll go on now to preparing for our third and final activity around the SDGs. We may get another one in as well, I don't know. Remember we put in the presentation film, and it's in the course book, but I'm going to go over it again. There are something like 245 indicators on the 17 SDGs, and 11 of them mention disability. If you think we are 20% of the population, that isn't very good. We need to think about others that we might want to add. So poverty, which is SDG 1, eradication of poverty, there's only one indicator, the proportion of the population covered by social protection floors, and that's broken down by sex, children, unemployed persons, older persons, and people with disabilities, pregnant women, newborns, work injury victims, and the poor and vulnerable, which is a catch-all phrase that we do not like. We don't like vulnerable because people are not vulnerable in themselves because they have an impairment. They are vulnerable because of the barriers that exist, because society hasn't been transformed so people can have a fair and equal access. So vulnerability it blames the victim, and we don't like that phrase. People at risk of exclusion, people at risk of not having this indicator is our chosen preference to that in the disability movement. Quality of education, this is, we've just seen how crucial that is, and we have in fact got 2 indicators here out of 36. Equal access to all levels of education and vocational training, including persons with disabilities indicator. So that's a general one. And then proportion of schools with access to adapted infrastructure and materials for students with disabilities. And it's how that's measured that is really the point. And I think they're measuring it by the numbers with ramps and accessible toilets, not necessarily access to the curriculum. The indicators for 8, which is work, 23 indicators, average hourly earnings of employees by disability. And that will very much show not only whether people are in work or not, but also what they're earning. Unemployment rates also by disability. And then we have reducing inequality, number 10. We have 25 indicators, and here we have 10.2.1, proportion of people living below 50% of the median income by sex, age, and disability. So how poor we are will be shown about that. It won't deal with other issues particularly well. Sustainable cities and communities. We've got 2 there, I think, or maybe even 3. Yeah, 3. 11.2.1, proportion of population that has convenient access to public transport. So you've got to be able to get onto that with a disability indicator. So that's an important one in city spaces, particularly. Average share of built up area of cities that is open public space for use by sex, age, and persons with disabilities. So whether the parks are accessible. Proportion of persons victims of physical sexual harassment by sex, age, disability status, and place of occurrence in the previous 12 months. For gender-based violence, that's absolutely crucial, and will actually reinforce the figures that we've talked about when we talked about that in our women's module. And then last of all, 16, peace, justice, and strong institutions. There are 14 indicators for that, and we have 2. Proportion of positions in the national and local institutions, including the legislature, that's the parliaments, the public services, and the courts, the judiciaries, compared with national distributions by sex, age, and persons with disabilities. So this will be quite an important factor. How many parliamentarians do we have? How many judges? How many people in the public services, teachers, social workers, and so on, administrators? And the proportion of population who believe decision-making is inclusive and responsive by age, sex, disability. So this is going to be a survey rather than an indicator. Okay, so bear in mind what those are. Remember, we've got 1, 4, 8, 10, 11, and 16. And to remind you what those are, I'll run through them. So 1 is poverty. We have none for hunger, none for health. 4 is equality of education. None for gender, except for that one under cities, which is gender-based violence, but nothing else. None for clean water and sanitation. None for affordable and clean energy. We have for work, we had 2 there. Industrial innovation and infrastructure, we have nothing there. We have the reduced inequalities, and we have sustainable cities. We have nothing for responsible consumption production, climate action. Think back to the program we did on humanitarian and climate emergency, of the issues there for disabled people. Living below water, maybe not so much there, but life on land, certainly. Peace, justice we have, but partnership for the goals, no mention of disability, other than the general catch-all that when we talk about vulnerable peoples, and I've explained what we don't like about that, it includes disabled people. So by the back door, we are there. Now, the activity is this. I've kept them up there as an aid memoir. The ones with a blue cross on it, 2, 3, 5, 6, 7, 9, 12, 13, 14, 15, and 17, no specific disability indicator. And on the left-hand side, we have the numbers that there is an indicator, which I just read out, 1, 4, 8, 10, 11, and 16. What I want you to think about and suggest an indicator for goal with no disability indicator, and what should it measure? Okay, so you can do a little bit of thinking here. On hunger, on health, on gender, on sanitation and water, on energy, on infrastructure, on consumption and production, climate, land and water, and partnership. What should we be measuring to show that this is an all-inclusive sustainable development goals? And you might say, well, we haven't got very long, we've got 9 years. I think that's true, but I would put this point in the air. What happened when the Millennium Development Goals that we started in 1990 weren't reached? They just rolled them over and said, we'll give you another 15 years. They didn't include us at all, so we didn't have any benefits from that other than the general uplift that took place. So what I think is likely to happen in light of COVID, which has rolled things backwards, and the lack of investment, which is also causing broadening of the gaps between richer and poorer are getting greater. We will probably have the countries of the world saying, well, let's roll them over and not do it in 9 years, but let's do it in 19 years to 2040. I'm only guessing, but I think that's what will probably happen. So it's important that we do some thinking about what other indicators we want to show that we're moving towards disability equality in the Sustainable Development Goals. So that's the aim of this activity. I hope that's clear to everyone. You need to pick one goal that isn't, we haven't got a target for, i.e. one of those with a blue cross, and think of an indicator which would measure progress for disabled people on that Sustainable Development Goal. Okay, I'll give you 2 minutes to think about that and get it written down. And it's just coming up to 1:15 now, so we've still got 15 minutes on the call, so we should be able to have a good discussion about this. People mute, please. For anyone who's lost, we're doing activity 3, which is on the screen. You have to identify a goal with no disability indicator. Ones in red show ones that have an indicator on the side. Ones with a blue cross, 2, 3, 5, 6, 7, 9, 12, 13, 14, 15, and 17 have no disability indicator. Pick one of those and say what it is you would want to measure to show progress on disability equality on the Sustainable Development Goals. Okay, I think that's 2 minutes. Sarah, do you want to read out what people are saying here?
Yeah, there's a lot in the chat, but I'll start with the last one here. 16, goal 16 could mean no racial discrimination, especially those who have double or triple discrimination.
Mm-hmm.
But I don't know what indicator that would.
Probably that would come under 16, wouldn't it? I think, but how it would measure it, I don't know.
Okay, SDG 3, inclusive health services as a standard tool for universal health.
Yeah.
By Freki Andrew SCN.
Mm-hmm.
Inclusive healthcare.
Yeah. What does she mention what we should use to measure that?
No.
Regardless of background factors, everybody has the same access to healthcare might be a way of doing that. Okay.
There's Grace Starling, 17, DPOs involved in goals, and they should be included in the formation of policies. If evidence shows that DPOs are involved, then the goal is complete. Mm-hmm. That's 17.
Yeah.
Beth Terry says activity 3 for SDG 6, percentage of people not able to access a water point or public toilet because of a physical disability. That's an indicator for number 3.
Yeah. I think that's a good one. Number of adapted toilets
yes,
would be a good measure, which we could argue for there quite easily. Yeah.
Okay. There's Crystal Inspire, number of women and girls who experience GBV and availability to justice and support services, SDG 5. Yeah. GBV, gender-based violence.
Gender-based violence. I mean, there was one in number 10 on that, but it was at number 11, it was for cities, wasn't it? So people in rural areas are not covered by that. So I think it's good that 5, all disabled people subject to gender-based violence would be good. We would have to measure it by people who reported it. And of course, there is massive underreporting. But if people knew that by reporting it, it would get recorded, and you would have to at the same time have the criminal justice system doing something about it, then it would work. Yeah. Okay, more?
Yeah, there's Lowry. No poverty could mean no food banks required or no homelessness, although this could be not what you mean, maybe. Mm-hmm. But no poverty could mean no food banks. I think that is number 12.
It's probably zero hunger, is it, or 12? I think it's number 2.
Yeah, there's zero hunger, number 2, and responsible consumption and production, number 2.
No food banks. And another would be that everybody has the required daily intake for a healthy life. And you would have to measure that by sample surveys, I think. But but that would also be quite, you know, what the level of malnutrition is. The UN does collect data on people, particularly for children who are undernourished, which leads to stunting, which is a form of impairment, because your people have frailty and are shorter than they should be. So yes, it could be built on, Laurie. Thank you for that.
Is Bernardine Ekabi saying SDG 15, life on land?
Yeah.
Number of disabled people who own land. There should be a number. There should be number of disabled people who own land for housing, property, for asset and farming. So that is an indicator that can be used for SDG 15.
Yeah, it might be owning or have secure access to with a lease or something like that. Yeah, or a rental agreement. Yeah. Okay.
Another one on gender-based violence again.
Yeah. Yeah.
Elora Ebonti Banik says on health section there is no mention of accessibility for disabled people, but this section is very important for all kinds of people. Severe physical impairments, mental illness needs therapy and rehabilitation. Every hospital aren't accessible for them.
And I think we also had raised this morning, which I think is important for women, access to reproductive health. And I think that might be a good indicator there for disabled women, how many of them get access to reproductive health.
We have one Fiona Akulu Okelo UG on SDG 17, again, all partnering for the goals, including organizations for persons with disabilities in order for their voices to be heard. So there should be maybe measurement on the linkages and the networks.
Yeah,
for partnering.
Advocacy point is there that if we are to partner at a national level, then our DPOs need, one, to have a base of local organizations that can gather views and information for us. So they need some sustenance so that they can do that. And our national DPOs need to be funded also by government if we're to be partners in this process. And what we find is that governments in many parts of the world are not funding DPOs, and therefore we can't really be proper partners in this arrangement. So maybe the indicator would be the number of DPOs that get proper government funding at national and local level, and that would show how much it's a genuine partnership. So I think that might be a way of measuring that. Okay, any more? Okay, we'll stop there. I wanted to just thank you for all of that, everybody. I'm not going to show this film, but I wanted to talk about it. Daniel Mont, you can find this on the internet, and it's an interesting film. What he's been doing is looking, as I said earlier, where there's a large amount of administrative data, like the school surveys, and he's been training people. It's been now developed as a whole country system in Fiji, so that they can actually train teachers to identify, using Washington scale data, how many disabled children there are in their class, and then align it with, in their locality, getting mixed surveys, which are household surveys, to identify, using the same data in the same catchment area, the number of children who are not coming to school. And that can then be used to plan and prepare for the school to meet the wider needs of disabled children. And if it's incorporated into the planning cycle of the Ministry of Education, they can then resource the schools and train the teachers with regard to the numbers that are actually there to be measured. Obviously, you would need to moderate it, because it would be very simple for the teachers to make up large numbers of disabled children to get extra resource. And that has happened in some parts of the world. But if it was moderated, it would give us a way of management from annual school surveys and so on, which would then be translated into resources. And this has been done in Fiji, and it's written about in the course book on this module. So I would draw your attention to that as a way forward. So I think we're reaching the end of our time, more or less. I've got a few things I want to say to people, so I'm going to come out of this thing and say hello to everyone. And I'll come to Sarah in a minute for a last word as well. But I think we've learned from today that you have to, as disability activists, as people running DPOs, you have to drill down and be skeptical when people give you statistics. You have to ask questions. What is this data based on? Where was it gathered? Who gathered it? How did they gather it? Which tool did they use? And how was it checked that it is accurate? And I think if we are asking those questions, we don't have to be trained in statistics to ask the right questions. That's the important point. We're not trying to give you a course in statistics here. This is data, and a lot of this data can be represented graphically, as we saw at the second and third slides, and that can make it much easier for many people to understand than lots of tables of data, which is actually quite difficult for people to understand. But if you say 1 in 5 people or 1 in 10 people in this area are disabled people, that makes it easy for everybody to understand. The other thing we've learned is if we ask questions which don't shame or make people feel belittled by the question, but rather ask questions about difficulties rather than disability, we get much higher numbers of disabled people. And I think that's also very important. So that's all I wanted to say on this. Sarah, a last word on the statistics data, and then I've got a couple of things I want to say to everybody before we all say goodbye to each other on this one. Sarah. You're muted. Yeah.
Thanks, Richard. Yeah, data is very important, but unless it is translated into some meaningful action, then it is just figures out there. And so what we are saying is that, yes, we are advocating for disaggregated data for disabled people, and we would like that data to be turned and translated into actions, into policies, into infrastructure development. And that can only happen when we as disabled people organizations push and advocate for governments and duty bearers to be able to account for us and to make sure that our data is important. For planning purposes, we need to push our agenda for making sure that we are included in development as a whole, as DPOs. Thank you so much.
Thank you. And that's a good trailer for the topic, which is DPOs and how they run, how they function, what their role is, and so on. And we've got a course book that will be going up tonight on that, and a film. So there's plenty for you to get your teeth into, and then we can discuss it at next week's seminar. And the final one, the week after, will be on influencing government. And on that, we will have an hour. And the last half hour, we will take views on the course, which we will record. We will have some people we will ask to give a prepared view on, and then others can give their view on the course after that. So we'll use the last half hour, and I'll also say something about how we hope to take this forward. We've already written to you all to say, if you want to be part of a network after this, sign up to become a Commonwealth Disabled People's Forum human rights advocate. And we've got 57 of you have sent in those forms. There are still plenty. They were sent out, and you can go back through Gemma's emails and find it and complete it and send it in to Martha at Commonwealth Disabled People's Forum. And she's doing the database on it. And the second thing is to ask everybody to make sure that they did send in the monitoring form on the first 7 modules. It's really important that we have your responses on this, because we are bidding for more funding to be able to spread this course offline onto computer sticks that we can take out into rural areas that are not connected on the internet in many parts of the world. But this information and all these seminars will be on that stick, so everybody can then run training. So we need money for that. So we need people's views on the course, hopefully positive, and that would be really useful. People have asked one last thing about the coursework. The date for the coursework is the 9th of June, but if that's too difficult for you, I'm extending it to the 17th of September. So there'll be no detriment to anybody. If you still want to get in the coursework, but you haven't been able to do it in the time scale that we have talked about, if you get it into whatever level you want to do, and remember there are 4 levels to get it in, then we will be able to accredit to after in those 2 weeks after the 17th of September. But those who get it in by the 9th of June, we hope to get you an accreditation by the end of June. And the reason we want the views is we are going to hold a side meeting at the Commonwealth, not the Commonwealth, at the Conference of State Parties, the 3rd week of June in New York, but it's online. And that's more important because we will actually not be having CHOGM this year. It's been cancelled again. That's the heads of government of the Commonwealth meeting. So we will be able to feed in more of what we've learned from this and other consultations that we've got going. So those are some extra news points for you to bear in mind. Now, put your cameras on, put your microphones on, and let's all say goodbye to each other for today. Okay, it's been a useful seminar today. Thanks to the signers, thanks to the captioners, thanks to Sarah and Gemma, and thank you to all of you for sticking with us. And I hope you stick to the last.
Thank you.
Okay.
All right.
Thank you. Bye.
Thank you.
Bye bye.
Be safe.
Bye bye. Thank you.
Bye bye.
Yeah,
Bye bye. Bye bye. Bye bye.
Bye.